Welcome everyone. My name is Tristan Claridge. I'm the convener of the Social Capital Research Group. We're an international collective of researchers on social capital. We have over 1,000 members that are loosely collected around the Facebook group and a mailing list and a website that contains a lot of resources. And we tend to hold these kinds of webinars about every 2 weeks with invited speakers and of course, presentations by PhD and master students as well. It's my great pleasure today to welcome Greg Fulkerson to give us an invited presentation. Greg is the professor and chair of sociology at the State University of New York. He received his PhD in sociology from North Carolina State University with expertise in the areas of global social change and development and rural community sociology. So he's going to be giving us a presentation today about disaster and the destruction of social capital, the effect of COVID-19 outbreak on a college campus. And after his presentation, we'll have a little bit of time for some questions. So over to you, Greg.
All right, thank you, Tristan. Hello, everybody. Good afternoon. Thanks for coming to the presentation. Hopefully we can get through it relatively expeditiously and we'll have a lot of time for a discussion at the end. I did get a few questions emailed in advance and I've already built those into the presentation at the end, so we'll make sure we address those. I'd like to start, let's see if I can, there we go, with a couple of acknowledgements. This research wouldn't be possible without the IKIC team, which is short for the Intermountain COVID-19 Impact Consortium, which formed shortly after the pandemic started, launching into rapid research. And so the team members were led by Dr. Alexander Thomas, James Zions, Elizabeth Seal, Michael McCarthy, Jingmao Ho, Dan Gadomski, Caroline Gomez de Cesare, Kirsten Kemmerer, and Patrice Halleck. So they were instrumental in collecting the data that will be examined in this particular study. And they're the ones who deserve credit for the research that was done. The data that the research team is focused on a region, not just college campuses. It's actually a multi-pronged research project. We're only looking at the student survey data, but we've also collected data from faculty, from elementary through high school, or primary or secondary school teachers, childcare providers, municipal government employees. So we really have a lot of things going on, but this particular study focuses on student survey data, which was probably one of the larger data files that we collected. We have some partners also that deserve acknowledgement. The Bassett Research Institute. Bassett is the major health institution in our region, at least in the southern portion of our region. The Center for Rural Vitality at SUNY Cobleskill, the Data Science Program at Utica College, and the Places Institute here at SUNY Oneonta, and Zogby Analytics, which is a polling firm based out of the Utica area. So just a little bit of overview. We collected data from students at 2 colleges. We actually tried to get a third, but it didn't get IRB approval. It was really difficult getting IRB approval for kind of obvious reasons, because every college went on lockdown when we started collecting data, and the IRB committees also went on lockdown, which unfortunately meant even though we started doing research immediately, we weren't able to get what we were hoping for, which was sort of a baseline measurement, which would have been very valuable for a before and after type of design. So that's one of the things we'll note is going to be one of the weaknesses of the study, but we can't say we didn't try. We didn't get IRB approval in time. But what we've got provides an opportunity to see what happens when a college campus does experience an outbreak in terms of the level of social capital on campus, particularly among students. And we do have data for other populations that we'll be looking at subsequently. It's a pseudo-experimental design because we sort of have one college where an outbreak occurred and the other college where it did not. So you have like a control and experimental group, but you don't have the before and after measurements. We didn't have baseline data collected before the outbreak took place. And of course, you don't have random assignment, so technically it can't be a true experiment, but it's pseudo-experimental, which is about the best we can do under the circumstances. I'm an advocate. I'm approaching this project as somebody with a great deal of interest in social capital who has taken that interest to the question of COVID, not somebody who's, say, a health researcher who has decided to dabble in social capital. So I'm more of a social capital guy than a health guy, but this seemed like a wonderful opportunity to explore the dynamics of social capital within the context of a campus community. Co-published an article quite a while ago now, but I think it still sort of stands up in terms of the distinction it makes and the way that we kind of think of social capital as having two basic variations when you look at all the ways that it's been defined and used in different studies theoretically and so forth. And that's the normative social capital and the resource social capital implications or definitions. So what I think most of us deal with is a normative version where we're looking at the Putnam interpretation of the concept, and Coleman is also in that camp, sort of looking at norms of trust and reciprocity. And that is certainly something that is part of this presentation. Actually, elements of both come into this presentation. I think there's hope of integrating these different variations. But essentially, the normative view of social capital, as I see it, is when you've got behavioral norms that lead to collective outcomes that are rewarding for the community, if that's your unit of analysis, or in some cases, your nation, your entire country, or probably smaller units of analysis as well, groups, whatever kind of collectivity we're talking about. It's based on norms. But the other variant sounds bad, sounds like a virus. The other variation of social capital definition, the resource one, has to do with more of an individual experience, a more individualized form of benefit in terms of what you gain from social capital. So, simply put, we could just say individual relationships that provide one with support and other rewards. And they can be very tangible rewards, like somebody found you a job, or something like that. So that will come into this project as well. We're going to be looking both at the individual level in terms of their level of perceived support and rewards from their own relationships. And we'll be looking also at levels of trust within the college campus in terms of specifically engaging in protective behaviors in the midst of an outbreak, in the midst of a pandemic. So there have been other attempts at sort of bridging between the two, the normative and the resource variations of social capital. Brehm and Rahn specify that individual social capital basically leads to broader scale levels of social capital, so they're linked necessarily in that regard. Jicka et al. Suggest that individual level social capital is also predictive of community social capital. So if you've got rewarding relationships, you're more likely to have greater levels of trust in your community. And so that's something we're actually going to have some empirical investigation for that. So that's our research question. Will students who have more rewarding relationships, their individual social capital, be more willing to trust or have confidence in their peers' adherence to protective norms? And so the collective good would be protecting everybody's health, right, in the midst of the pandemic. There's actually, we were saying briefly, just kind of informally before the presentation started, that it's surprising how much research has already not only been underway, but published on COVID-19. And there's actually a burgeoning, though small, literature on social capital in COVID. So what has it found? Mostly, social capital has been found to limit the spread of the virus, also to limit the negative health impacts that occur, mostly because of age-specific exposures and susceptibility. among the elderly population especially. Social capital mitigates social and psychological costs of COVID. That is something we have collected data on. We do plan in the future to study also some of the psychological distress that has been brought about by COVID, and we'll have the opportunity there to test once again whether or not social capital mitigates that. So I'm looking forward to that as a follow-up study. Now, there was one sort of counter-finding by Elger et al., who found that more social capital at the national level was actually associated with a higher death rate from COVID, which is counterintuitive, although you might infer that if there is higher levels of social capital, there might also be higher levels of social interaction. And a lot of spread does occur through social interaction. So that's one possible explanation for that. Now, there was a critique of that particular study by Lindstrom, more along empirical lines, because the research depended on the world values survey data, and Lindstrom thought that was not a good choice methodologically because the data are collected on a rolling basis, creating some time order problems in terms of establishing causality. But those were the few studies that specifically looked at the link between COVID-19 and social capital that have been out so far. So our research question from that, how can a COVID we're kind of looking at the other way, how can a COVID outbreak affect social capital? And so usually social capital is treated as a mitigating or as a causal factor, not as an outcome. So that's one way in which this study differs from the others that have been published. Glad Dr. Recker's in the crowd here. Community shocks research, I think, comes to play here because when an outbreak happens on a college campus, you can't think of a greater shock that could take place, really. So a really good opportunity to apply this framework, I think. Community shocks can refer to anything. If you're focusing on typical communities, it could be the loss of an employer, for instance, like everybody's working for the same factory and they announce they're closing it down. That's another type of community shock that can really have a major impact. But shocks aren't always that giant in size. They can also be minor shocks. Small stores close that everybody liked or something like that. So shocks, the community shocks framework, I think is helpful for helping us think about the campus as a community and kind of framing what the pandemic is doing. So from that, and they kind of framed the two competing hypotheses here for, what should we expect as a result of this shock? The consensus crisis effect versus the corrosive community effect, where, one hypothesis says, these disasters will bring people together. And there's actually research on natural disasters we could also cite here that would suggest that when a community undergoes a major disaster, neighbors will come out, they'll start helping each other. You'll see all sorts of new norms of reciprocity and trust emerge. So in other words, social capital is enhanced by disasters. But there's another segment of the literature that says that may happen to a point or under some conditions, but if the damage is too severe or too irreversible even, what might happen is actually you get past a point of no return. So in other words, the social capital is just sort of damaged as a result of the disaster. It's not enhanced. So our research question is, as a shock to the college campus, the COVID outbreak, will it have a corrosive or a constructive effect on community level social capital? So those are kind of the research questions we're looking at and some of the literature. The last one is a little bit of research on social capital, specifically on college campuses. So what have other studies found with regard to social capital? There has not been anything that I've found specifically looking at COVID and social capital on college campuses, but there have been other health-related studies and various other studies of different outcomes like grades, also looking at bridging social capital and racial diversity on college campuses. So they found, for instance, social capital has been associated with lower risk from binge drinking, improved attitudes towards instructors, better relations with instructors, better GPAs for students. One study found that social capital was not enough to overcome the racial wage gap post-graduation. So the alumni of colleges, even if say the students of color were to have greater bridging social capital, that didn't necessarily mean that they were getting better jobs. So that's interesting. Most of the research is focused on diversity issues. And what they found was, for instance, one study of athletes found that female and white student athletes had higher social capital in the context of the United States. Students with high class privilege had higher social capital in its rewards, which had kind of a Bourdieuian perspective. Bourdieu was interested in how social capital could help reproduce social inequalities. One study looked at the effect of Black cultural centers and found they were effective at building more bridging social capital on college campuses. Another one found religious organizations were effective at promoting cross-racial interaction, CRI they called it. But again, nothing specifically on COVID. So if we just try to derive a research question from the research that's out there, our question is, will the effects of a COVID outbreak have differing effects along the lines of gender and race? And we did measure those in our survey, so we have the opportunity to test those effects. So a little bit about the methods. Data were collected in January of 2021. There are actually 6 waves of data collected, so we did have earlier waves, but not all of the waves asked the question specifically measuring individual level social capital. More of them asked the question at campus level, but it wouldn't have allowed the full test of all of these research questions. So I'm focusing on one of the waves that had the data that are relevant to this particular set of research questions. So the goals of the survey were broader than just looking at social capital. We were looking at both the social and psychological impacts of the pandemic, whether or not people were adhering to safety protocols in terms of wearing masks, social distancing, quarantining if they came into contact with somebody who was infected, and then also asking about their perceptions of others. Did they think other people were following the protocols? We also asked some questions about later waves, not this one. We asked about willingness to get the vaccine if and when it's available. And we'll have further study of that in the future. And also asking where people get their information. So we looked at different traditional media sources and social media. So I'm looking forward to some of the results of that too. The sample, we have 1,710 students between the 2 colleges. So 478 were at the college without the outbreak, 1,232 were at the college with the outbreak. So slightly larger number of students experienced the outbreak. So it's not a 50-50 kind of breakdown between the 2 colleges. One college is larger than the other. The measures for the individual and the collective levels of social capital that were mentioned earlier. At the individual level, the question was to what extent do you agree with this statement? My relationships are supportive and rewarding. And so we had a 7-point scale. 1 would mean they didn't have supportive relationships at all. And a 7 would mean they feel that they have very rewarding and supportive social relationships. The campus level measure was their confidence, which I take as a synonym for trust. What level of confidence do you have that your peers are following the safety protocols? So this is sort of like a collective action, sort of a classic collective action problem, right? Where we're relying on everybody to adhere to norms to maintain the collective good of health, right? And when you have an outbreak, it's usually because there were free riders. And in the case of the outbreak here on this campus, the free riders were students who threw super spreader party events. So you can imagine how that unfolded. So this broke down. So the question is, what does this do then? Because this is January, the outbreak happened in September. So a few months had gone by. What was the lasting effect of this outbreak on the students' levels of trust in their peers? Right. And so the other measures In terms of race, we've created a white, non-white binary variable because we didn't have large numbers to really explore beyond that within the non-white category. With gender, we had a male, non-male binary. We actually did have a question that allowed for gender fluidity. We had one person who identified as fluid in terms of their gender, but the rest were identifying as male or female. And then we had I'm treating the outbreak with also a binary coding, right? Did you experience the outbreak, yes or no? So those are the measures that are going into the analysis here. So again, with those research questions in mind, the hypotheses, more specifically, we expect in terms of race that white students as college students on campus will have higher levels of individual and campus level social capital based on that research that's already been done. And similarly, we expect that male students will have lower levels of individual and campus level social capital. Not a lot on the gender dynamics in the research literature, only the one on student athletes. Of course, athletes are a special subpopulation and maybe not representative of all students. So you have to keep that in mind. We need more research probably on the gender dynamics of social capital on college campuses. In terms of the outbreak, again, it's the competing hypotheses of the corrosive community versus crisis consensus. In other words, is the outbreak good or bad for social capital? And then the mitigating hypothesis. Does individual level social capital mitigate the damage that's done to campus level social capital? All right, so let's get on to the analysis results. So just a quick overview of what the analysis is going to do. We're going to be testing those hypotheses in terms of social capital at the individual and campus levels, looking at the effects of sex and race as well on those levels of social capital, determining whether the outbreak caused damage. Clearly from the title of the presentation, you know what the finding is there. It's kind of pre-given. And investigate the mitigating effects of individual level social capital on campus social capital. So this is a quick side-by-side of the students who experienced the outbreak versus those who did not, and their levels of individual level social capital. So, people saying, I've got supportive and rewarding relationships. And you could see that most students from both populations scored pretty high there, with the modal category being a 6. Right, so a lot of students feel as though they've got rewarding relationships, which is good news probably for both campuses. It also sets the tone for how we interpret the scope conditions of this study. If we were to look at another campus and maybe the individual levels of social capital might be lower, would the results be different? That'd be something to explore. So skewed to the left, right? So you have students who report fairly high levels of social capital, and then comparing between the outbreak and the non-outbreak students, you don't see a lot of difference there, right? You see that maybe slightly lower in terms of those who had the outbreak, but we can't really assign that difference to the outbreak in and of itself. This is the campus level measure, confidence in peers. And so here we do see a difference in terms of the campus that didn't have the outbreak. You can see that similarly, they had high levels of campus level social capital, right? You can see that a third of them rated it as a 7, which is the highest possible score in terms of their campus trust in peers. Whereas the school that had the outbreak, half that rate, right? So a big difference going on here in terms of campus level social capital, just on the descriptive level, without any controls or anything. So the peak for the outbreak students was a 4, which is substantially lower than the individual level social capital. A quarter of the students saying it's only a 4, and about a third of the students saying it's lower than that. So big difference. Were those differences statistically significant? We could see from the chi-square test, the individual level this one, there's not a significant difference using the non-parametric chi-square test. But when we look at the campus social capital, where you can see visibly there are some differences. Yes, a whopping chi-square score, significant at the 001 level. When we look at it in terms of a bivariate correlation, we do achieve significance with a Spearman correlation, which is specifically designed for ordinal level data, which is probably more appropriate, though more limited in terms of how far we can go with the analysis. But if there is an effect, it's very small. We can't make a big deal out of a small effect, even if it is statistically significant. That just means we have a large sample of 1,700 students, more or less. But you can see that on a bivariate level, the effect of the outbreak, because this is a correlation between the outbreak and social capital levels, you can see that there is a negative effect, right? It's moderate, it's not a big one. Minus 246 Spearman correlation, minus 241 Pearson correlation. I like to put those side by side because, well, Spearman is the more appropriate correlation measure. You can't build more robust predictive models with that, so we use Pearson for the next stage of the analysis. But you can see the results are very similar. So the final analysis, I wound up using a path model because we did want to test a mitigating effect. And we don't have any latent variables here because we didn't have multiple measures of social capital, which I'll admit is a weakness of the study. It's always ideal if you can have 3 or 4 measures at least of a concept. So we have a one-to-one correspondence between concept and an indicator. But it's enough here, I think, to allow us to test some of our hypotheses. So on the left are the standardized coefficients. On the right are the unstandardized coefficients. So with the unstandardized coefficients, recall the social capital variables are on a 7-point scale. So where we have the outbreak, the effect of the outbreak on campus level social capital, that's the big story. Reduced it by about the equivalent of 1 point almost, right? 0.89, almost a full point lower level of trust for the outbreak campus than the non-outbreak campus. And that's the bigger effect. You can see there's a small negative effect, again, thinking back on the bivariate level, where, yes, and by the way, all these paths that are in the model are significant. I removed the non-significant paths at the 0.05 level. So yes, the outbreak had a slight negative effect also on individual level social capital. So both types of social capital experienced negative reduction from the outbreak. Now, and that's true even when we control for gender and race. In terms of the effect of gender, we could see that being male actually led to a higher level of campus level social capital, with male students reporting slightly more confidence in their peers. But there was no significant effect on individual level social capital. So there was no gender difference in terms of students saying I have rewarding relationships, which is kind of interesting. And then the opposite was true for race in terms of white, non-white comparison, which, as crude as that is, based on the data we have, is what we're left with. Interestingly, there was no effect on campus level, which really kind of flies in the face of a lot of that literature looking at the bridging social capital relationship. But what we did see was white students had some advantages in terms of their individual level social capital. But as a result of the mitigating effect, you can see the race actually has an indirect effect on campus level social capital through its effect on individual level social capital. It's just not a direct effect. That's something that future researchers doing research on gender and social capital might consider on college campuses, is this indirect effect. And then the mitigating effect was the other question we had. Does individual level social capital mitigate the effect of the outbreak or gender or race on campus levels of social capital? And you can see there is a slight positive. We saw this also at the bivariate level. those with more rewarding relationships were more likely to have more trust in their peers. We shift over to this side. These are the standardized coefficients. So that allows us to assess the strengths of the relationships. So these numbers look more similar to the coefficients we saw, the correlation coefficients. Although now we're controlling for some other variables here, so they're slightly different. So we could see, yeah, the strongest effect was the direct effect of the outbreak on campus level social capital. Now, trust levels went down after the outbreak. Whenever you have a free rider, get caught, when you have a collective good at stake, the free rider problem, you're probably going to see this type of thing happen. People lose faith in their peers at maintaining that collective good. But we also saw slight diminishment of the individual level, but not the effect there was almost negligible. The next strongest effect was actually the effect of individual level social capital on campus social capital, which was positive. So I guess that's part of the good news. So it also gives us some ideas to discuss and think about. So I'm going to move past the model. We can always cycle back to that if anybody wants to take another look at it. The conclusions that we take away from that in terms of race, white students were expected to have higher levels of individual and campus level social capital. Partial support for that only for individual social capital in terms of direct effects. There was an effect on campus level only through the effect of individual social capital, so it's an indirect effect. So in that case, you could say arguably it's supported for both, but one not in the way that was expected. In terms of gender, male students were expected to have lower levels of individual and campus level social capital. That was based on a study of athletes. Again, that didn't generalize, it seems. It's the opposite, not supported. So higher levels of campus social capital were found for males, no effect on individual level social capital. In terms of the outbreak effect, comparing the corrosive community versus crisis consensus effect, well, the support seems to be in favor of the corrosive effect, right? The deterioration of trust following a disaster. And then what about the mitigating effect of individual level social capital? Expected increased campus social capital, and that was supported. All right, so those are the statistical hypotheses and their statistical conclusions. A little bit of discussion about that. Some bad news here, the outbreaks, and who knows if we can generalize to other types of pandemics. I hesitate to do so because there's a lot of uniqueness about this particular disease that I'm not sure would be the same like if it was a Spanish flu or something. So I would hesitate to generalize beyond COVID-19. But as far as COVID-19 outbreaks go, there was unfortunately a negative effect on both individual and especially campus level social capital. The good news though, investing in individual level social capital can help bolster campus level social capital. So that gives you sort of a lever to think about. If you're a campus administrator or somebody who's involved on campus trying to build campus level social capital and trust, just making sure that individual students have supportive and rewarding relationships is one avenue for doing that. Then also paying attention to the gender and racial dynamics. That's another important factor. Yeah, so the effects of gender, they were associated with campus social capital, males reporting more confidence in peers, not associated with individual social capital. That was unexpected. I think we already kind of covered that. The effects of race were associated with individual social capital, with whites reporting higher levels and more rewarding networks as expected, though surprisingly not directly associated with campus social capital. So there's something there that should probably work into future studies of race and college campus social capital. Limitations, some of these I mentioned up front, in spite of our best efforts, because we really did try to collect data right at the beginning of a semester. IRB approval was not forthcoming, didn't occur until after the outbreak. So we didn't get baseline, which is really unfortunate because we can't do a truly longitudinal comparison. We can't truly see if there was a process type of change that took place. We can only look at the after effects. So it could have been the case that campus level social capital differed between the campuses regardless of the outbreak. We can't rule that out. That's one of the drawbacks of any kind of pseudo experimental design or other campus level effects. Again, measurement, bit of a weakness too. We'd like to have more measures, more indicators. The survey wasn't necessarily designed in order to do research on social capital. It just so happened that there were some indicators there that we could use. So we have something here. It's not ideal, but something that's workable. I threw out a lot of ideas in terms of directions of future research that we'll be going in, but also some nuggets that other people might be able to use for their own research agendas, not necessarily on COVID, but other aspects of social capital, say on college campuses, for instance. We're going to be looking at psychological distress and vaccine hesitancy, our research team. So I look forward to seeing where that goes, and hopefully maybe we'll have a future presentation for you on that down the line. So that's the study. We've got a few questions and answers sent in advance. So I wanted to just address some of those up front before we opened it up. I think we're doing really well on time. So we'll have plenty of time to get in other questions. The first one was compared to the many pandemics our world has experienced. How do you see the most damaging effect of COVID-19 on social capital and the dynamics of lives? Well, again, I would hesitate to generalize beyond COVID-19. One of the really unique aspects of COVID-19 is it's got a very high percentage rate of asymptomatic carriers, which can really exacerbate spread, which is part of the reason why it became a pandemic, because a lot of people were carrying this virus who didn't know it, because they didn't have any effects in terms of their health. They had no indication. It turns out, they did research on the outbreak on the campus we studied, and it turns out the student actually knew they were positive and threw the party anyways. So that's disappointing, isn't it? But also informative for us studying this kind of research. But I would expect, kind of reluctantly, in terms of generalization, I would expect a similar destructive shock effect. I really do think the shock paradigm would work well regardless of pandemic. But I think if it was a more damaging disease, one that guaranteed mortality, that could have more significant shock value and more significant shutdowns. And my guess is people wouldn't be free riding as much if there was like certain negative consequences to free riding, but if it's more of a gamble, like if you feel like we're young and we're healthy and this COVID thing might be more like a flu than an actual life-threatening disease, you could see why, the free riding problem would emerge more with this type of disease. So I would explore some of those questions before I generalize to other pandemics. And it's not necessarily going to be the case that there's always going to be a technological fix. So one of the things that's bailing out the United States, which essentially failed to have a behavioral response that was sufficient to stop the spread, is that we had a technological response, right? The vaccine is bailing the country out, and now the country is reaching something like 60% vaccination rate. It's kind of like enabling in some ways of poor social capital, right? I mean, we failed to respond behaviorally to this collective action problem, but we got a Band-Aid put on it anyways. So it's kind of like a bailout. That's how I see it, because it could have been addressed behaviorally and with significantly less cost, both in terms of lives and economics and so forth. Next question, would you be interested in expanding your project to other countries? Yeah, I think it'd be great to test the generalizability of our findings at other college campuses, especially in other countries, other contexts with very different socioeconomic conditions, intergroup differences, ethnic differences, and so forth. It'd be very interesting to explore that. So yes, Mohammed, you can contact me. I'd be willing to follow up with you if you're interested in that. Next one is a more sort of serious and dangerous, violent threat local farmers are facing. That sounds like in the context of Nigeria. And what that could be doing. Now, this would qualify as an extreme community shock when you have, bands of armed militants or what have you going around and threatening people's lives. Clearly, that's going to be about as severe as it gets. Yes, that's going to be devastating, probably to social interaction and to trust. Having said that, I could say I have no expertise in that particular. I'm not a military sociologist, but I could see where you would go with that type of research. But it does raise questions. Maybe there are some protective behaviors that farmers can implement, some kind of warning systems even to put in place. But beyond that, I don't really have much else to offer on that one. It's certainly an interesting question. This next question asks, how do we relate social capital to entrepreneurship? Specifically in the field of aquaculture and value chains. I haven't looked at either aquaculture, or I'm not an entrepreneurship researcher. I've been following some of that. Other people are doing that. I find it interesting. But I think there are some aspects. I mean, that's the nice thing about, as we develop a more robust theory around social capital, I think all of us can at least form some hypotheses about what could happen. As far as with entrepreneurship, what we're trying to do is promote more rewarding relationships, because I see that as more of an individual level social capital question. Providing people with rewarding resources. Those resources could be things like mentorship, like having good guidance, teaching somebody how to run a business, for instance. It has a lot of import, for instance, when you look at microfinance and that kind of thing. But again, we're getting pretty far away from the research project with that one. The next question, what do you think of what government can do to strengthen social capital? Or how can government destroy social capital? That's really a great sort of policy question, which I think all of us have given some thought to. I'm not a political scientist, I'm a sociologist, so government's not my expertise. But I think everybody has a right and should think about government involvement in terms of solving some of the problems that undermine social capital. So immediately what comes to mind is, if government really wanted to invest in social capital, investing in research on social capital would be one starting point, if nothing else. Investigating how to solve various problems with these kind of collective behavioral responses. Normative behavioral fixes, right? So this is collective level social capital we're talking about, not necessarily individual level. But I could also envision government programs that promote giving people better resources in terms of what they're getting from their relationships. So providing funding, maybe through non-governmental organizations even, might be better at fostering social capital than governmental organizations. And that could be applied to both the individual and the collective level. So those are just some of my thoughts on some of the questions I got. Great questions. Most of them probably a little bit outside of my expertise, but that's it for the pre-sent questions. So I guess now we can open it up for a broader discussion.
Yeah, thanks very much, Greg. Fascinating presentation. If you want to just perhaps stop sharing your screen, we'll be able to go back to seeing everybody. I thought I might start with the first question, and then we'll open it up for questions from everybody else as well. A couple of weeks ago, we had a presentation by Evangelos Tontis, who's a social psychologist, and he talked about how social capital responds in disaster situations. And I think his focus, certainly pre-pandemic, was of course on disasters that were probably far more short-lived, floods, earthquakes, these kinds of events that perhaps have a time span that lasts days or perhaps weeks, and at the most maybe a month or so. I think his approach using social psychology is really focusing on social identity and the way in which emergent communities form in response to disasters. But I think it's fascinating with COVID how the timescales involved. You were collecting your data probably around about 9 months after the start of the disaster. The emergent communities may have shifted and changed and dissolved by that sort of point. I'm not sure if you caught Evangelos's presentation, but how do you think his approach and the social identity approach from social psychology potentially fits into your understanding of social capital?
Well, yeah, that's a great question. I didn't catch the presentation, unfortunately. I did read some of his work before the presentation. I was hoping to make it. I wanted to be prepared. Yeah, I think you're right. Some of those emergent groups, some of those dynamics probably worked out by the time our data collection began. And we didn't, that actually raises questions about like a meso level, because I'm looking only at individual and then at major collective entire campus community level. So I haven't really looked at the group level, but I think these could be mutually, supportive studies, in terms of what's happening more at the micro level. My bias is probably macro, as a kind of a macro sociologist by training. So I don't have a lot of background in social psychology theory in terms of identity and that type of thing. Some of my other work actually on urban rural dynamics has gone in that direction a little bit. And we are actually going to be, well, we've actually already found a little preliminary findings in terms of urban rural identity. That's something that few people actually measure when they examine urban rural differences in social capital. They usually just look at the essential differences of geographic space. So if you live in an urban place versus a rural place, but it's very different when you ask people about their identity. Like, do you think of yourself as a city person or do you think of yourself as a country person? Because you can imagine there are lots of people who are city people living in the country because they ran away from the cities, especially for us. We're 3 hours from New York City, and directly south of us are the Catskill Mountains, which is where many New York City residents fled when the pandemic really wreaked havoc on the city. And many people don't plan to go back. And it's actually the second event like that, because 9/11 was the first one. Many people left New York City after 9/11 and never planned to return. So I'm probably getting a little bit far from the question. I apologize for that, but thinking about identity requires a really deep thought, I think. But I think there are urban-rural identity differences. I'm guessing that the other scholar could probably help me sort that out. But I do know that urban-rural differences in social capital exist too, so it'd be interesting to bridge that piece into it. I think we may have enough data to do that, not necessarily with the student sample, but we have survey data on some of the adult population, specifically child care providers and teachers. So we'll be able to test some of those identity questions with those populations. Maybe we can even collaborate together on that one.
It seems like it's a little bit of a challenge for doing research because Evangelos's research seems to indicate, and his theory seems to indicate, that social capital is quite dynamic. And so it can emerge really quite quickly in response to certain situations. And so, if we had been collecting data at the beginning of the pandemic when there were potentially emergent communities occurring and a very strong sense of identity forming, not necessarily at the sort of at the social grouping level less than the actual campus, on a campus level could be forming identity and emergent community even at that level, which is quite a broad level. So we can see how it could be really quite dynamic, that in the space of just days, it could pick up quite considerably. And then in the space of weeks, it could diminish quite quickly. And there's potentially, and this is where his research is exploring some of the ways in which those emergent communities potentially could be maintained. So they come up, they can be quite strong, not necessarily, but how can they actually be sustained and converted into effectively background level social capital that can continue indefinitely?
Well, actually, it makes you think of two questions for me. One is, will time heal it by itself? Like is this dynamic social capital going to change just over time? Or is it changing because of things that are happening? In other words, we have causes for these dynamics to shift. Using the community shock framework, I would say that, if you have specific policies in place designed to build social capital, that can be effective, which I think is good news, because as we were talking with Dr. Putnam, the initial response was it take 3 centuries to build social capital for a nation? It's very discouraging from a policy standpoint, because that doesn't sound very dynamic. That sounds very static. But my hypothesis is, as you go from the macro down to the micro level, it gets more dynamic. And when you go more to the macro level, and almost all the research I do at the macro level, it's like gravity and planets. It's just very predictable. But when you start looking at the micro level, it's like quantum physics. You have no idea what's going to happen. So I think it's a good analogy.
Yeah. One more thing on that before we move on to questions from other people. I think that sorry, I've actually lost my question. It's too early in the morning. We'll come back to it. I actually have other questions as well, but I want to make sure we get to others. So who else would like to ask a question? I see there's a few in the chat. Does anyone want to unmute themselves and ask one?
I can actually.
Yeah, go ahead,
I just actually threw it in the chat. Thanks, Dr. Fulkerson. I've been a fan of your work for a long time, and I'm actually just down the road from you at Binghamton.
Oh, wonderful. Thank you.
Yeah. And so I use, I am interested in youth social capital from rural contexts, particularly as it pertains to academic attainment and identity and college and career readiness. And that's what I'm studying here now. But I was just curious about, in this own work, and you sort of touched on it a little bit, but if you had taken into account any kind of student origins, right, with these 2 college campuses, thinking about that rural-urban divide and perhaps some impacts or influences based on where these students are coming from. Just thinking, again, our student population here at Binghamton is predominantly from downstate and Long Island and the city, and so based on sort of peripheral or just impacts or perceptions of the virus and of the pandemic, I wonder if that could be seen as being influenced by origin.
I'll leak some of it because I do plan to do a big rural urban study. But we asked, I don't know if you've ever seen the GSS, the General Social Survey question, which is also adapted, I think, to the International Survey, which is, the question is, where did you grow up? And then the options are a large city, a medium city, a small city, in the country, not on a farm, in the country, on a farm. And we did actually, I did look at a crosstab between that and the dependent variable in this study, and also willingness to engage in protective behaviors, sort of what was the level of concern, and what were the differences between urban and rural students. And it's probably, as you would expect, rural students were less concerned and less willing to engage in protective behaviors. As far as that went, that was not the identity question, though. That was where they're from. So that doesn't necessarily mean they identify as rural people, even though they live there. And that's something that we're trying to emphasize, and I think we'll have a unique contribution on that. And I haven't actually looked at that as a control, but I can tell you that some of the preliminary findings, as far as traditional measures of urban rural go, kind of stand up to what other researchers seem to be finding, and we're hearing in the news a little bit about urban rural differences as far as concern about the virus and willingness to engage in protective behaviors. So the other one we asked was actually a variation on that, and it's where would you like to live, which I don't think the GSS asks, because that gets into preference, and we're trying to measure urban rural preferences. So would you prefer to live in a large city, a medium city, a suburb, in the country, not on a farm, in the country, on a farm? So I think we're gonna see some correlation between that and where they live now, but it's not going to be a perfect correlation. So ultimately, we're going to look at all 3 of those variables and how they interact with the peer trust, but also behavioral outcomes as far as masking and social distancing. We have a lot of questions on those types of things. But that's going to be in the context of an urban-rural study. So it didn't really come into this one. So that's to be continued, I guess. I envisioned myself doing that first, but then the opportunity came up to do the social capital study. So that took priority.
Well, let me know if I can help.
Absolutely. Yeah, I'll get your information. We can follow up since you're right down the road anyways.
Excellent.
We've got a question in the chat from Shweta. I'm not sure if that's your name. That's on Zoom. The outbreak of pandemic led to complete lockdown, leading to changing structure of social capital, less interaction, but it enhanced it through online networks. What are your thoughts on increased interaction networks and the role of technology on social capital of people's lives?
Yeah, that's a great question. And actually, I think, going back to when we looked at the individual level measure, if the lockdown were devastating to people's individual level social capital, would we have, because we didn't see a lockdown on the same scale. I mean, where the outbreak took place, there was a total dismissal of students from campus. So everything went digital there. Where the outbreak did not take place, students continued to go to classes in person. So we actually have data for that, question. And since the data were collected in January and the outbreak was way back, as you mentioned, 9 months earlier, we could see that even 9 months after the lockdown, there's barely any difference between an individual level sense of having supportive and rewarding relationships between the two student populations. So that's surprisingly resilient. I think maybe there was a slight, we did notice a slight, barely significant kind of negative effect, but it certainly did not destroy people's personal relationships, which I think is good news. I think it gives us hope that maybe some of these digital technologies could substitute. But I would caution that conclusion. I mean, we need a more carefully designed study around that question, controlling for some of the other variables that we can't control for in this particular design. But yeah, great question.
And I think also the technology is already changing. There's already more facilities for social interaction using these technologies. And as we're using them more and more, like for a lot of us, like Zoom is virtually our life now. And as we're using them more and more, we're finding ways to enhance the quality of the social interaction that can occur. So it's probably just as much about the technologies that are available as much as the norms about how we use the technologies that probably supports this. So I'm sure it'll change over time as well.
Also, well, it begs the question of, what kind of divide is going to happen in terms of access to the technology, as well as basic internet connections, which also has an urban-rural dynamic, especially on the global scale. But even within New York State, we have a lot of rural areas that are underserved with broadband.
Yeah, absolutely. And I'm just waiting for that hologram technology where we can virtually feel like we're in person without being in person. We need to get the tech developers on that one, I think, because
It's already happening. Microsoft has already got a Holo program that does that, but it has not been disseminated very widely.
Yeah, that's right. And again, like talking about access, like these new technologies, again, is going to potentially be a barrier to some people getting access to these new technologies with the enhanced level of social presence as well. So we'll move on to a question from Marion, which is actually very much along the lines of the question that I forgot earlier. So she's in Sydney. She's asking, while not specifically part of a section of your research, and I'd acknowledge that as well, that you're not really able to control for these other sorts of variables in your research design. She's noted about how the place where people get their information from. So they're in Sydney. The media is now reporting on the first lockdown basically since the start of the outbreak. So I'm sure there's a question in there somewhere, but I guess we're interested in your thoughts on that.
The question, sorry, Tristan, the question is where, did I actually sort of see that there was a question in amongst your research about where individuals got their information from?
Yeah, we collected that information as part of the latter waves of the survey, but it didn't come into this particular study. We will be investigating, though, some of the differences in terms of where people get their news. And we have both traditional media sources as far as channels go that people might watch, contextualized to the United States primarily. So, but we try to get the full range of, say, conservative, moderate, and liberal media avenues. We did also ask about political ideology. Some of the, although we haven't looked at our own, we haven't drawn any conclusions out of our own data yet. There are some surrounding regions doing research, also exploring political ideology, and their preliminary findings are that we're making too much of a deal of political ideology, which is maybe good news.
Yeah.
The media is really framing it as an either or sort of political thing.
Yeah.
And it turns out it's much more complex than that.
But
Which is,
those of us involved in campus life in various forms around the world are interested in building that campus social capital, and that you've actually sort of talked about the link between the individual and social capital. So all of that will have fascinating ramifications, and it's just fresh in my mind because yesterday I had to email my students and say, sorry, we're all back online. So we were planning to be together in the classroom. So with only a 4% population, don't get me started, vaccination, then we have had to go completely back online and we don't know for how long. But the communication things I think are fresh in my mind, and I think that you've got to, the great interest would be in how we communicate with students individually, building their social capital and then the campus capital. I think that's a worldwide interest no matter where you are. Yeah. Thank you.
Yeah, and I think I'll just reinforce that, we need to be paying attention to both different levels of social capital and also the different meaning in terms of whether we're talking about resources or the normative components.
Yeah. Thank you.
When people do this research. Yeah.
And certainly in the
watch this space.
In the webinar a couple of weeks ago, Evangelos was talking a bit about the way in which leadership and those sort of specific social interactions that occur within the context of a disaster setting can really positively shape the direction that it takes. And there's certainly evidence to suggest that where there is a lack of leadership or a certain type of leadership or certain events occur, even in these emergent communities that are often associated with really positive social capital outcomes, the outcomes can be negative, just in relation to that sort of specific messaging that can occur. And this is something that's obviously very relevant in New Zealand because we had a Prime Minister who had very good messaging. And so a lot of people that are attributing the response, the community response to COVID, and therefore the strong social capital that basically existed within the community to just simply the messaging that occurred, not really to any necessarily existing or underlying social capital that existed within the community.
Yeah, I think that actually, when I think of responses to collective problems, I mentioned two, a behavioral response and a technological response. And I think you just pointed to a third one, which is a structural response. When the government actually takes control and implements policies that more or less solve the problem, instead of allowing it to languish, which we had here, more or less.
And the same thing must be true on every sort of level within every social structure. A university can take action and at that structural level can provide certain messaging which shapes norms and attitudes and behaviors and everything else, all the way down through to within individual friend groups, even though it's completely informal social structure, still the way in which people within those informal social groupings relate to the problem and start interacting can obviously have a major impact on the outcome.
Mm-hmm.
Should we move on? Any other questions from the group? Feel free to unmute yourself if you'd like to ask a question. Doesn't seem like anyone wants to. A question's just been posted in the chat. It isn't mutual interest as a proper social distancing should be clearly defined in terms of social capital, not as a policy in campus to work effectively. Maybe policies versus mutual interest destroy social capital as you described. There are already types of social capital in the campus, in gender, activities, etc.
Yeah, mutual interest. Yeah, I think that's, and this is actually the collective action problem goes back long before social capital research. And when I was writing the article from 2008, I went back and read Maker Olson, The Logic of Collective Action, which is still, I think it still stands up as a very good statement on this particular issue as far as solving collective action problems. And of course, Garrett Hardin, and the lifeboat approach, and then the scenario that he creates in terms of the collective grazing land and what happens when you have free riders who allow their herds to graze and eat all the grass, and the other shepherds are left with nothing. I mean, I think this is all part and parcel to the mutual interest question. So the question, can you have policies that require that? I mean, you can have contracts, like students we have like a student conduct contract, for instance, that students sign, but can you force students to trust one another? Can you force students to keep the best interest of their classmates in mind? You can try. You can even threaten, and I think that's the more likely administrative approach is, if you do this, you're going to be expelled, or you're going to be punished or fined, or whatever kind of negative sticks rather than carrots are often used to enforce rules. But if you feel compelled to trust other people, are you really trusting them, or are you just putting on a performance? I mean, these are really interesting theoretical questions, and it does make it difficult for administrators, who are trying to say, what do we learn from this? How do we cultivate campus level social capital? Because you can't just force it into existence because now you have an emergency where you have to solve a collective action problem. It has to be an ongoing effort to build campus social capital so that when something like this happens, you don't have a negative consequence, right? You have a proper collective response, and you don't have a free riding problem, and that's really why you cultivate it, right?
And humans are quite complex as well. So it's quite difficult. What we say or what's in a policy or a document isn't necessarily how it's interpreted. And it's the same thing with the leadership, like the Jacinda Ardern here in New Zealand was saying certain things, but doesn't necessarily mean that people interpret those things for her intention, what she intended these things to mean. So it adds another whole level of complexity. Like typically in the past, when I've looked at trying to modify social norms within a campus, a higher education campus environment, a lot of it's about trying to align all of the messaging so it's all consistent. So there isn't confusion about what's expected of me in different sort of contexts or from different places. But so much of it still ends up being into how it's interpreted. I would say that our campus is primarily focused on building individual level social capital, and they do that by encouraging participation in clubs. Join this club, join that club, join this fraternity, that sorority, do these things, and what you'll be doing is building all your network. And they're probably thinking, of course, good network means when you graduate, you'll have more opportunities, more weak ties, as Granovetter would put it. You'll get good jobs and you'll write us big fat alumni checks. So that's part of the college's interest, right? They want some return of their own investment, in these students' social capital. But they're not thinking in terms of cultivating campus level social capital necessarily. And that, as we see, could be dangerous, right? If you're not cultivating that, and you're not necessarily, yes, it does help by investing in individual social capital. There is a slight positive effect on campus level social capital, but they're not the same thing. And you need to have separate efforts going on to address, this kind of collective trust and this collective, sense of reciprocity at the campus level. Yeah. And bringing up, of course, that there can be negative outcomes as well from trying to build social capital in that kind of way, deliberately from a top down, especially if we're trying to, form a really strong sense of belonging. Quite often when that occurs, it creates inclusion and exclusion as well. So I think something that universities probably need to be careful with, if they're trying to build the community at the campus level, the university level, they're trying to build social capital. Quite often they do so by basically forming a strong sense of identity or belonging in the university, but that can create a bit of an us and them kind of environment. Yes. And a lot of the policies can be
political, or what I would call window dressing, where they look as if they're building campus level spirit and those kinds of things, but they're really just not having much effect. They're not very effective strategies. It's actually very difficult. And I don't have an answer for what the best policy is on that, but
Yeah.
that's tough. It's really tough
and
to build that.
Partly difficult because of the way it's interpreted, that it's not necessarily interpreted as it was intended.
Tristan, can we throw in multicultural campuses
Yes.
such as Western Sydney?
Yeah.
Throw that dilemma in as well. So I just thought I'd bring that in as a
well,
comment.
and some of the, I think, I kind of went over quickly in the presentation. I did look at some of the research on bridging social capital between groups on campus. And the research did support that, like in the US, having like a Black cultural center was helpful for, aiding Black students in developing more ties on campus, bridging ties. There was the other study on religious organizations. That's going to work differentially depending on where you implement that and how you implement it. And certainly the administration can't really get involved in that. That's outside of the realm of administration. But it does.
Fascinating. Yep.
Yeah. But it does hopefully mean that multicultural centers are not just window dressing. They actually do accomplish something, which that's good news, I think, based on the literature.
Yeah. Thank you.
All right. Any other questions?
Say just real quick,
Yep.
and I know you'll be careful on the generalization components with this, but could you maybe speculate, as you vary the organizational size or maybe the structure of the organizations, what do you think the impact might be on your conclusions? Thinking, for us that find this really interesting, but are maybe at a different size institution or something, what parallels might we draw from that, understanding that, you're a little beholden to what you can generalize off of?
Yeah, and there's doubtless going to be some relationship between the size of the collectivity. That's what we were saying before. And the relationship between individual social capital and that campus level social capital. If you have 60,000 students, for instance, it's not going to be the case that every student knows each other. But if you're at an institution where there's 1,000 students, it's possible that everybody's at least aware of everybody else on campus. So there has to be some kind of effect. We don't have the data to test it, but I would certainly caution on generalizability to larger institutions. What we're looking at, one college was a little over 1,000, the other was 6,000. So not huge, medium and small, I would say. Medium, smallish to small. So maybe that relationship between individual and campus level would be weaker at a larger institution. So I'd want to see that study. I would want to know if that's true or not. That'd be my hypothesis. But who knows? I'm sure that's got to be a question that all that literature on campus social capital has to think about. It's like, does a multicultural center work as well on a giant campus versus a small campus? Campuses are also unique as a community because they have a lot of turnover. You have a complete, after 4 or 5 years, you have total turnover in terms of who lives there, as far as students are concerned, not the faculty, hopefully. We have a certain amount of that. Might be on pace with 3 or 4 years, actually. But yeah, with students, it's totally turning over. So to go to Tristan's earlier observation about, the dynamic nature of social capital, even if you have a traumatized cohort, as they matriculate out, is the social capital going to rebuild? And I would think so, on some level. On the other hand, there may be some kind of permanent alteration to campus level trust that exceeds the individual and far outlives any of the students who live through this event. I mean, that's going to require extensive follow-up research. And by the way, we do intend to do this survey next year, so we'll be able to have some answers, hopefully, as far as the long-term effects. And I'm hoping to find that all is well and good and that it's all healed and time has, but will it be time or will it be policies? I mean, I don't know that we'll be able to tease that out, but. I suspect that we'll see some improvements. Yeah.
I wonder if there's been any research done on the impact on social capital of the football team winning on the weekend, and then Monday morning comes around, and how do people feel about their institution?
That's right. Yeah, that sense of, well, solidarity. I don't know that it's collective solidarity. I have some of these theoretical questions about Durkheimian solidarity versus social capital, and
can I jump in
on
the football question?
Sure thing.
I'm thinking of different colleges and whether they explicitly try to cultivate an identification with the college. I'm wondering if you're having any questions about how much do you think of yourself and your identity as a student at a particular college. Penn State goes crazy with it. I mean, people 50 years later wear Penn State things and Penn State mugs, and other colleges, some city colleges, people don't really identify with the college very much at all. That wouldn't be a significant part of their identity. And in terms of cultivating social capital on the broad college level, that is something I think some administrators very concretely try to do. And football team's a prime example, but there are lots of group meetings where you have group cheers and all this kind of stuff that are very explicitly intended to help the student, or encourage the student to identify themselves strongly as a member of that college community. So I wonder if you'd reflect on that.
yeah, I could see that being the case, but maybe that goes to the question of large versus small colleges as well, because it tends to be the larger campuses that have the more robust sports programs. And sports do have this kind of function of promoting collective identity and solidarity in a way that we don't always see at smaller campuses, unless it's around something besides sports. Like you can cultivate campus traditions and rituals that are not necessarily tied to sports. I remember I interviewed for a job at a school in Texas, and they had so many rituals. You couldn't walk on the grass under this tree because it had this historical significance. So there's sacred spaces on campus, and it had nothing to do with sports, but it kind of struck me as very Durkheimian. Like, this is very fascinating to me. But there was a high level of solidarity on that campus as a result of all these rituals that were in place, all these kind of cultural practices. So I don't have any answers, but it certainly raises interesting questions.
We've moved into that space of narratives, and how narratives shape our understanding of solidarity and belonging and trust and norms and so forth. Mm-hmm. I think, Aminal, I think you were looking to ask a question just before. You want to ask yours?
Thank you, Tristan, and thanks, Gregory Fulkerson, for your nice presentation on social capital, especially on the COVID crisis. I know the limitations of COVID vaccine for the lower income country. They are not getting vaccine. It should be public goods or common goods for the humanity of the world. And you also explained the social capital and entrepreneurship. I think it's running on social capital and social business going on full swing. And you also present on the social capital and estate role. That means government can include people's participation. That will increase the social capital strength.
Yeah.
And my last worry is on the first slide. You explored that social capital associated with higher death. How do you explain it?
The last one didn't come through. Could you repeat that?
Social capital associated with higher death. in your third slide. Can you explain it, please?
Well, that wasn't my study, but that was one I found in the literature that was actually more of an exception. I can share the references if anybody wants, by the way. I can email them. Feel free to email me after the presentation, and I can send you, because I know I had a lot of references but no reference page. So I could send you that if you wanted to look up some of these other studies that I mentioned in the presentation. Yeah, that's sort of a baffling finding, just to speak to your last questions about the death rate being higher in countries with higher levels of social capital. And it could be the case that that's just a measurement fluke, that finding. But if it's not, yeah, I just speculate that potentially it's because there's just higher levels of social interaction where you have more social capital. I mean, those are correlated, right? You're going to have more trust and reciprocity with people with whom you're interacting with on a more regular basis. So the other questions you had, the first one was a question about generalizability, and for instance, going to a context, a less developed country, lower income. Yeah, I think that you're probably going to find different baseline measures of social capital potentially. But as far as the impact of what an outbreak does, or the ability to respond to a collective action problem, well, the thing about behavior is that you can have high levels of social capital in countries with low income. You can have a good collective action response, but it's also the case that some countries that are low income are such because of a history, say, of colonialism, and a number of historical institutions that have sort of bred distrust and so forth, and historically, and have built that into the culture almost. So, I mean, that takes us more in the direction of a Putnam-esque kind of discussion, where you have this more permanent national level social capital deficit, which could actually be interpreted as a national level shock imposed by external countries and so forth, imposing colonial trade relations and exploitative kind of economic practices and those kinds of things, which diminish social capital in the long run. And I would not discount that at all. I think that's another angle you don't often see explored in the social capital literature, but something I'm attuned to as a macro sociologist who does a lot of cross-national research. And I think we do have to keep that in our mind, that social capital doesn't just grow internally, that there are external factors that can shape, whether or not social capital will be able to flourish. When you have military conflicts or invasions, or just really exploitative economic relationships, all of those things can undermine social capital in ways that we can't really blame the population for. Developing distrust, right? Because they've been victimized. Of course, you're going to be less trustful if you've been victimized. And that's actually something that's coming up in our vaccine hesitancy investigation, because in the United States, some of the subpopulations who are less trustful of the vaccine, the Black population, for instance, was subjected to unethical research. If you're familiar with the Tuskegee syphilis study, which essentially, African-American research participants unwittingly were given syphilis and then were not treated, with the sole purpose of seeing what the effect of syphilis would be. And even when the treatment came out, penicillin, they were not given the treatment. So they were allowed to continue to suffer in the interest of science, of the researchers just wanting to know how badly these men would suffer from syphilis. So you can imagine, if you're a part of a subpopulation that has been mistreated by science historically, you might develop some distrust. And those are the dynamics we have to be sensitive to. Social capital could be degraded in these ways that are well outside the hands of the victims, who are now distrustful. We can't turn around and say, well, it's your fault, you don't have trust in each other. It's tone deaf to do that, right? Because it's not paying attention to the historical legacy of why distrust can form, in the first place, which I think is especially important at the cross-national level.
I think you've made a good point there as well, that, you know, within our lens of social capital, we could look at a correlation between high levels of social capital and a particular outcome and say, well, it's because people interact more, and that's got to be the reason why. But of course, as you've identified, there's a whole range of other possibilities that could exist for the reasons why. And talking personally with the experience here in New Zealand, even on the cultural level, there can be some very specific cultures that could result in transmission of the disease. You know, things like in New Zealand, you know, the hongi is really important. And so, you know, we get together for funerals, and that's the family gathering is so important that people are prepared to risk their lives, you know, potentially get COVID, because that cultural event is so absolutely important in our society. And so, you know, there can be differences that can't be picked up just simply by saying, well, there's more or less social capital. It can be specific actions that could be resulting in higher rates of transmission. So any other questions from the group? We've got time for one last one, if there is anything. Feel free to unmute yourself if you'd like to. No, it doesn't look like anyone has any final burning questions. I think we're just about out of time anyway. Well, thank you very much, Greg, for your presentation and for all of the discussion that we've been able to have as well. It's certainly been really fascinating to have these discussions.
I appreciate it. Thanks for the opportunity. It's wonderful.
Thanks, Greg. So the next webinar is going to be by Professor Daniel Aldridge, who's also going to be talking about social capital and shocks and crises kinds of topics. So it's actually 3 webinars in a row with a similar kind of theme. So that'll be in 2 weeks' time. The details are on the Facebook group and also on the website if you would like to register for that one as well. So let's leave it there. Thanks very much, Greg, for your presentation.
Thanks a lot. And feel free to contact me if you want to follow up. I'll put my email here in the text in the chat.
Yeah, sure thing.
There we go.